How to treat tension type headache. The management of tension type headache includes both pharmaceutical and non-pharmaceutical interventions and aimed at relieving pain, restoring function, and improving health-related quality of life. Comorbidities should also be considered in the decision-making, which may include depression, anxiety, sleep disorders, neck pain, or other chronic pain conditions. Infrequent tension type headache can be managed primarily with acute treatment and lifestyle modifications, but frequent episodic tension type headache or chronic tension type headache may require preventative pharmacotherapy and or behavioral interventions. Patient education plays a large role in the management of tension type headache. It is important to discuss with the patient the pathophysiology, important lifestyle habits and factors, potential treatments, and the prognosis of this condition. Most attacks of tension type headache can be managed with simple analgesics such as paracetamol or acetaminophen, aspirin, non-steroidal anti-inflammatory drugs or NSAIDs, and non-pharmacological strategies such as sleep hygiene, regular practice of relaxation techniques such as meditation and diaphragmatic breathing, hydration, and physical modalities such as massage. The efficacy and safety of paracetamol, aspirin, ibuprofen, and ketoprofen in the acute treatment of tension type headache have been shown in randomized controlled studies. Other NSAIDs, for example, naproxen, diclofenac, have less evidence for efficacy, yet are common in practice. There is also evidence that caffeine, when combined with acetaminophen, aspirin, or ibuprofen, improves the efficacy of the analgesics in the acute treatment of tension type headache. The key objective of prophylactic treatment are to reduce the frequency and severity of attacks. Though preventative treatments have not been demonstrated to prevent tension type headache chronification, many clinicians prescribe preventatives to prevent progression and to reduce the risks of complication which are attributed to medication overuse. For the most cases of frequent episodic tension type headache with less than 10 days with headache per month, there is no need for prophylactic treatment. In the case of frequent episodic tension type headache, characterized by 10 to 14 days with headache per month, the prevention may be needed, particularly when the tension type headache attacks affect the ability of a person to function properly in the roles such as work, school, and family responsibilities. In the case of chronic tension type headache, preventative treatment is indicated. Preventive treatments may be pharmacologic or non-pharmacologic. Multimodal treatment should be tailored with each individual patient and may include interventional medicine treatments. The evidence-based guidelines for the pharmacological prophylaxis of tension type headache recommend 3 agents for the preventative treatment of tension type headache. It is amitriptyline with A labeling as a first line, and venlafaxine and mirtazapine with B labeling as a second line. As a third line treatments, the recommendation with label B includes clomipramine, protrolin, and mianserin. Thiazidine, which is a muscle relaxant, may be used in the practice for the prevention of chronic tension type headache. There are a range of non-pharmacological therapies with good evidence and safety for prophylactic management of tension type headache. Guidelines recommend that they are considered first. They can be combined with pharmacotherapy or administered on their own, and includes physical and occupational therapies, biobehavioral treatments such as cognitive behavioral therapy or CBT, biofeedback, and relaxation therapy. complementary and integrative medicine, which include acupuncture, massage, management of sleep, dietary approaches, stress management, and lifestyle modifications.